And again, I'm back with a beautiful lady who's in the studio with me today, who is a part of the Pearl White Gala, our seventh annual Pearl White Gala. And this is Miss Katherlyn Geter. And Katherlyn, how you doing?
I'm doing good. How you doing?
I'm doing great. I want to welcome you to Caregivers and Community Connection this morning. Thank you for coming in and sharing a little time with us. But you know what? I want you to tell the community exactly what you do on a daily basis.
I am the program coordinator for the State Health Insurance Assistance Program, SHIP, and that program primarily provides Medicare information and counseling. And a lot of people don't know is that, that although we do provide counseling to those on Medicare, but we work a lot with professionals, like such as yourself, business owners, that serve this population of people. So it makes us to be a great program because we provide unbiased information about Medicare. I tell people the easiest way to remember us is that we're the local resource when it comes to Medicare benefits versus calling the 1-800 Medicare number.
Well, one of the things that I look at is at the end of the year, every year, I think about Medicare Part D, and I automatically think of Katherlyn Geter. So, I mean, and I'm always having you on, whether it's radio or now TV, and being able to tell the people, you and I come to this city and to this community. When it comes to that, now, I got to ask you the question.
Okay.
What do you think about the Healthcare Act? Everybody is just really going crazy about this Healthcare Act, and and I always like to ask opinions because you deal with people every day not have insurance.
Very true.
And knows the importance of people being insured, especially in a time of a crisis.
Yes. You're not the first person that has asked me that question. One of the things that we do is what makes us a great resource in the community because we stay connected to a lot of the federal agencies, CMS, Social Security, the Department of Human Services, all these great big organizations that provide the benefits that we're talking about. The Affordable Care Act is such a huge piece of legislation. I will say it's going to affect every American, and that I applaud individuals such as yourself that are help getting the word out. There are a lot of good things about it. I mean, there's a lot of things about it that I would probably say may concern people, and it should. But overall, in terms of the population of people we serve, seniors and those with disabilities, a lot of great benefits have not only taken place, but will come 2014.
Now, I noticed that one thing is with the youth, with the children.
Yes.
A lot of times when people graduate from college, they're unable to get a job, to get good insurance benefits. And now it's already in place, to my understanding, that they can stay on their parents' insurance to the age of 26.
Age 26, and that's one of the great provisions. As you mentioned, it's very difficult for young people to obtain not even employment, but even that, a good employment that would allow them to have affordable access, access to affordable insurance. So that is one of the great provisions. Now that's not a worry, that they can stay on their parents' insurance up to the age of 26. So that's one of the great provisions that we've seen.
And denying children care.
Pre-existing conditions.
And that's a good one.
That's gone,
and I think it's going to be 2014 before it'll happen for adults, right?
Exactly.
But the major thing that you and I deal with so much is that donut hole.
That donut hole. But there, again, the legislation included, I applaud Congress, and I applaud our president, and I applaud our legislators that really looked at Medicare in the sense to see that was one of the big concerns for seniors was, great that Medicare brought on prescription drug coverage, but we still knew that there were a lot of people that could not afford their medications. And when ultimately they were hitting that donut hole, that was 100% liability to them. And thanks to the Affordable Care Act, that's gone. Whereas now they're receiving discounts on brand name drugs, 50%, generics 14%, and until the year 2020, they'll continue receiving those discounts towards their drugs, and then the year 2020 it'll be completely gone away.
Let me ask you something in reference to medication.
Okay.
It was asked to me on Saturday on the air. And one of the things, what do we do about people who are not on Medicare Part D, who might be a diabetic or something, and they need to get medicines, but they're unemployed on disability, what would be some of the things that you would tell that individual to do?
There are, of course, you know, number one is always talk to your healthcare provider. I strongly stress that anybody that I counsel, I always say, have you talked to your providers? Because ultimately they're the ones that have provided that prescription, so they may know of very resources or can assist in some way. So that's number one where I'll say start. And then secondly, there are so many resources out there that I feel a lot of the African Americans primarily don't know of and realize. The pharmaceutical companies, oh my word, they're out there helping people. I mean, you can go through them. They have programs, especially for people uninsured. You can get a 90-day supply free of charge. You can't beat that. And one of the other things that we have started researching is there's a lot of foundations. If you're an individual with diabetes, there's some facilities and foundations that will help not only with medications, but even treatments, helping with dialysis, transportation to your dialysis appointments, whatever ways to assist you in maintaining that chronic condition. We had a lady in our office, her sister had cancer and was on Medicare. So, I mean, although she had insurance, but she still couldn't afford her prescriptions. So we applied for this foundation, and they received over $3,000 to use in whatever way they saw fit for the care of that loved one.
Well, my thing would be for the community is to really try to stay in tune with their SHIP director, which is yourself and the other volunteers that you have working with you, coming to some of your workshops. I know that you have them. Can you tell them possibly how to get in touch with you if they need to maybe call you about some of this that they're hearing this morning?
Our toll-free number, it's a helpline number, is 1-877-801-0044, and that is primarily the main way to contact me. It comes directly to my desk. I tell people you will get my voicemail, but I do return the phone calls. We usually return them within a day or two. And like you said, we're always holding classes. We will have, in terms of the enrollment event, Medicare enrollment event coming up, actual enrollment sites where people can come. We're going to be in the community to make it easier for them, and they can come and get that one-on-one help.
And what we'll do, I think, during that time, we'll bring you back to the air and let you just really tell the community about Medicare Part D and how important it is and where we are. And we encourage people to talk to their congressman since, with this Affordable Care Act, and especially people who don't have insurance.
Exactly.
I mean, you can go bankrupt overnight for trying to pay for something that you don't have.
Exactly.
But that's the reason why we did the Senior Expo. And last year was our first year with the Pearl White Gala doing that. So, and you coordinated that part of the event. And I want you to just tell the community a little something about it that would encourage them to get their friends together, their church members, family members, to be a part of it.
Well, again, it takes individuals such as yourself to have a vision to see that there is a need out there in the community for this information. So as you mentioned, it was our first Senior Expo that we had, and we had it downtown at the Trade Center. And it was really great because we had providers, a range of providers in terms of services and products being offered to this population of people. And it was really great to not only bring them in so that they can showcase their organization or their information, but having the community come out and know that, number one, there's people out here that care, and then secondly, know that they can come to this type of event and get and see the person. Sometimes we'll call a business and we don't know who we're talking to. Well, at a Senior Expo, you can talk directly to that vendor and ask questions. And I thought we saw that, and I think that was really beneficial.
It was great. You had exercise and everything going on at that Senior Expo, and I'm looking forward to it. And we're looking to have it, though, the day before the event.
Yes.
Which will be September the 7th.
Correct.
And the location, as of yet, we hadn't planned that one yet. I think we're going to have a meeting today.
Yes, but regardless of where the location is, individuals need to come out and support. Again, these types of events make a great way for you to have a group of people in one room, in one environment, and just get access to information that you might not have already known. And even if you did know about a particular organization, they could be offering new information at this event. So it never hurts to come out and support and get the information in terms of helping yourself and your family.
Because a lot of times I know we try to get it from neighbors and friends, and we get wrong information. And so this is a way that they could come out and talk to that person that actually interacts with that service on a daily basis.
Yeah, and one of the things that we wanted to do with the Senior Expo, as you mentioned about the exercise, that was kind of our way of thinking outside the box, because, you know, our health is so important. It's a topic that we discuss all the time. So we thought, well, not only bring in this provider that does this, but what if he actually demonstrates? And it was Tai Chi that we did. And believe it or not, there were so many people participating with him that they had that hands-on kind of learning. So that was really nice to see, and we hope to include a lot more of that this year.
Well, I'm looking forward to the Senior Expo and getting an opportunity to give a giveaway.
Yes.
I know we did that. They got excited.
They got excited.
But we're looking to bring information out into the different sites that take care of elderly people on a daily basis, like you all did before, and possibly looking at a transportation service provider that can bring them to the site. So we'll do that and just make it a joyful evening of learning and having fun.
Yes, that's what it's about.
So I am looking so forward to us doing it, and I'm looking forward to you coordinating it.
I think, again, it's always a great opportunity anytime that I can be a part of such a great cause to not only educate our community, but to network with other providers that I sometimes don't on a daily basis get to. It's just great. And so this is what this type of event is. And although you might have came last year to our Senior Expo, don't let that stop you. You definitely want to come back, because we're going to have newer and better providers.
I can see how our health fair has increased. I could see the Senior Expo going to that level as well.
I agree.
And I think that's the end of our show. And thank you again for coming.
All right,
and I enjoyed interviewing you today.
Thank you so much.
Okay. I want to thank you all for tuning in to Caregivers and Community Connection today. We'll be here every Sunday and Saturday morning, 7:30 on Saturdays and 8:30 on Sunday mornings. Please tune in, tell a family member, a friend, a neighbor, a church member about what you heard today. Hopefully you're going to be looking forward to the 7th Annual Pearl White Gala that's going to take place on September the 8th at the Chattanooga Convention and Trade Center. Also, I want to encourage you all to use some of the services that you heard from Ms. Katherlyn Geter today with the SHIP program. Also, Ms. Kristen McWhirter from Family Caregiver Support. And all of these programs is through the Area Office on Aging and Disability. Also, if your loved one is in need of an adult day center, please don't forget about Sharon's Adult Day Center in Chattanooga and Cleveland. Call us up at 698-2611 or visit us on the web at SharonSeniorServices.com as well. And then I want you to also think about, if you're looking for a good place to come and have dinner, please stop by Mocha Restaurant and Music Lounge. We're open Tuesday through Saturday. The doors open at 5 o'clock, and up until Thursday, we close at 9 p.m. And on Fridays and Saturdays, we close at 1 with a live band. But the thing you're going to remember, that I need you to remember to do, is to have lunch with us. We're here Tuesday through Friday from 11 a.m. to 3 p.m. daily. We do carry-outs, so if you work in a company and it's a $50 order, we'll bring it to you. We also do catering, so if you need something catered, we'll do that. As well as if you're looking at a small workshop that you need to do and need a venue, please think about Mocha Restaurant and Music Lounge. You can check us out on the web at mochajazz.net, or you can call us up at 531-4154. And I'm sure someone will get back in touch with you as soon as possible. So, but this weekend is a great weekend at Mocha. We have Bruh Man from the 5th floor with Martin from the Martin Show. We also have Chris Thomas, the man of 1,000 voices. We're looking forward to seeing you this weekend right here at Mocha Restaurant and Music Lounge. Please tell a friend or a neighbor about coming down and spending some time with you. Also, Girlfriends Gather will be having its second series here on July 26th. The doors are open at 7. The cost is only $5, and we're looking forward for you all to come in. Thank you so much. See you next week on Caregivers and Community Connection.